But first up, you do probably know someone with a severe allergy or food intolerance. But the Food Standards Agency has estimated that 2 million people in the UK are living with a diagnosed food hypersensitivity. That's ranging from anaphylaxis to intolerances. Natasha was 15 when she ate sesame seeds embedded into a baguette, which were not only invisible, but not recorded on the list of ingredients in the packaging. Shantae was 18 when she died of a reaction to a hazelnut, and her EpiPen had only a child's dosage in it, and the ambulance took more than 40 minutes to reach her. Well, Tanya Ednan-Laperouse and Emma Turay are the mothers of those teenage girls who tragically died, and they're here with me now because they're calling for the government to put in place an Allergy Tsar to prevent what they say are unnecessary deaths and illnesses. A government petition has gathered more than 20,000 signatures, and consequently a debate was held in Westminster Hall here in London yesterday. Well, both Tanya and Emma were there. They join me now. Welcome both to Woman's Hour. Thank you so much for coming on the show. Firstly, can you update me on what happened in the debate yesterday?
Yeah. So there were a number of MPs that, and we were really pleased. They echoed quite resoundingly our concerns, in the allergy world, and that they had lots of statistics that we've quoted through yesterday. That 1 in 3 people now have some sort of allergic disorder, and that we've been calling for a national champion. It's been a call that's been made from the allergy community for over 20 years. So all of the MPs were in full support, and they all laid out some really, well thought through and researched arguments supporting what was necessary. At the end, there was a summary given that Dr. Claire Bethune had been appointed as a national speciality advisor for specialised immunology and allergy, and that happened last year, October in 2022. This was something that the allergy community were not made aware of, and it came as quite a shock. We weren't aware of it. And I guess our initial response to that is that, whilst we're welcoming that there is some recognition, what we need is somebody who's trained in clinical allergy, as opposed to immunology.
Okay, so you were listened to. In a way, they're listening to you and trying to be proactive with this national advisor, but do you think it's enough?
No, we don't. We think that, they are chairing a clinical reference group, which is led by NHS England, and they're acting in an advisory capacity. And we think that it is a step, but it's not a step that's big enough at all. And it's not a step that addresses the modern day epidemic in allergies that the UK is currently facing, and that is what the data is currently telling us.
This is huge at the moment, isn't it? Tanya, Natasha died in 2016, and you've campaigned relentlessly in this area for a long time now. Natasha's law, of course, came into force in October 2021. How has the law around allergies changed since 2016, and do you think it's been enough?
Well, excuse me, Natasha's law came into full force in October 21, and that means now that if any food is prepared and packaged in closed packaging on the same premises, it has to contain a label with full ingredients with the allergens in bold. So that meets the criteria, and it's certainly been life-saving information for many people, but that's just one area that was failing people with food allergies, and it particularly, obviously in our case, it led to our daughter's death. But there's so much more that needs to be done, and really what we discovered, we started the foundation following the campaign for Natasha's law. The more we scratch the surface of all the things that we need to do. Excuse me, I'm so sorry.
That's all right. Go away, we've got lots of time.
Sorry.
Take your time.
Thank you. The more we scratch the surface, the more we realise that a lot more actually does need to be done.
Yeah.
And so, calling for this Allergy Tsar, which is really another name for an allergy lead, somebody appointed by government, but not a government minister. We need a clinician, someone that really understands allergy. The reason for that is that so many more people are becoming allergic. We have 1 to 2 minimum allergic children now in every class across the country. And that wasn't the case 20 years ago, even 10 years ago, that wasn't the case. And yet people are falling through the cracks to get an accurate diagnosis and to get the right treatment. And that is resulting in severe hospitalizations for anaphylaxis, which has gone up by 615% in the last decade. And it's also resulting in deaths.
You both obviously feel that your daughter's deaths were preventable, and this is why you're challenging this and charging forward. Emma, you've talked about what you see as a fragmented system, actually. So how could an improvement in the way allergy services are organised have made a difference to your daughter?
Well, in Shantae's inquest, they actually found 20 failings, which range from the categorisation of the ambulances. So the ambulance, so whether you call 111 or 999, anaphylaxis is a life-threatening disease, and as such, Shantae, when we called 111, she just felt unwell. And her condition rapidly started to decrease while we were on the phone for the clinician who called an ambulance. Now, I was on that call for over 40 minutes as Shantae went into cardiac arrest, and I carried out CPR until the ambulance arrived because it was wrongly categorised as a category 2 and they went to the wrong address. Now, that was just one of the many failings. Other failings were that, our GPs, who we rely on and we trust, they prescribed her with an EpiPen. She was trained in the EpiPen. When they changed her EpiPen to a different brand, Emerade, we were told, which is what the GP had been told by the clinical commissioning group, that no further training was required. Now, had we opened it and read the leaflet, we would have realised, but you trust your doctor and you trust the dosage that they prescribed to you for medication. Shantae had a child's dose, so it wouldn't have been able to sustain her had the ambulance have arrived in the 7 minutes. That was the likelihood. So there's just a plethora of so many things. The GPs not being fully trained in allergies, and actually they are not allergy specialists. There's not enough allergy specialist clinics across the country. You get a different level of service. It's a real postcode lottery of, people not having one clear pathway, one clear health plan that's been coordinated.
Which as parents must be so confusing and terrifying, actually. When did you both decide to come together and start campaigning together and trying to make a difference to this?
It was following Shantae's inquest. So we had met the year before, hadn't we? And my husband and I, we supported Emma and her family during the inquest. And when the Prevention of Future Death report came out, the coroner was very clear that there's a real call and need in this country for a national lead on allergy because, as Emma explained, 20 different errors, and every single one of them could have on their own led to Shantae's death. And so that call was made then. And that's when we really started the campaign, didn't we? But since then, other coroners have been calling for the same following inquests of other young people and children. So this isn't two mothers coming together with, with our own story. We're carrying on our shoulders the stories of other people. And we're also very aware that we are, for an allergic community, an allergic family, we are people's worst scenario. They fear what happened to us, for them and their family every day. And so we do it for them.
Well, 20,000 people have signed your debate. That's an incredible amount. I think you only need 1,000 to get it to Parliament, so you have gone above and beyond. But tell me about your daughters, if you can, because we're talking about them, but we want to know them. What was Natasha like?
So Natasha was just joyful. She was really easy. She was an easy child. She was fun. She was a mix of tomboy and girly. She was really close to, she was a mummy's girl. She was a daddy's girl. She was a bossy sister to a younger brother. And she she was an incredible artist, and she was really good at singing, and art was just what she was just naturally good at. And she was just thinking about what she wanted to do for her A-levels, and she decided she wasn't going to do art. And I said, why not? That's such an obvious subject for you. You'll do so well in it. She said, well, I'm not going to be an artist. I've decided I want to study law. I want to be a lawyer, and I don't need art for that. And I was so proud of her. Just she was. It was that 15, just thinking about her life and what she wanted, and that maturity. It was just, her world was her oyster. Well, the world was her oyster at that time.
I can tell she sounds an incredible young lady. And Shante, what was she like?
Probably the complete opposite. Really, quite outgoing, very loud and bubbly. I think what people remember her for the most is just the wit and the amount of laughter that we had around her. She was incredibly funny, but there was a serious side to her as well. And very much like Natasha, she had just secured a university place to study law as well, which was and she was quite the campaigner at school. So she was sort of applied for head girl, and whenever something happened at the schools, the teachers would say, we know Shantae's coming, because she was sort of a bit of the campaigner. And so, I think both our girls were sort of budding lawyers, and I just think what we're doing for them, and that,
well, I can see where they got it from completely.
That sense of social justice. I think they'd be incredibly pleased with what we've done, and we like to think that they're together, don't we?
Yeah, of course they would. And the way that you are working forward on this together, there must be things only the two of you can understand. Does that help you through the grief as well as the hope?
I don't know. There's nothing that can really help you through the grief, because it's your journey, and everyone has to do that themselves. But we understand each other's grief, don't we? And we've got, I think, it sounds a bit cliche, but we almost feel a bit like we're sisters now. We've just kind of in tune with each other and what the other one is experiencing, going through. I'm ahead a little bit of Emma's journey, in my journey of grief. So I've sort of been able to just kind of lead her a little bit. But everyone, like I say, they have to go through their own path.
And how did being in Westminster yesterday feel, or how did it leave you feeling? Did it leave you feeling like you are working towards something? The campaign for your girls is heading somewhere.
It was positive. It really was. So when the ministers were all in agreement, and they were actually in agreement of an allergy lead and Allergy Tsar. Then when the minister summarised, he left the door open, and they don't usually do that. He said that he was willing to come into conversation with us, that they would have meetings to discuss this further before that happened, and that he was leaving a door open.
Okay.
And we were told that is quite unusual, and that's very promising.
And Emma, I know you've written a letter to Steve Barclay, the Health Secretary. What have you said to him?
I think we've both echoed that our daughters' lives were entirely preventable. But, we're coming together to save other lives, and we are highlighting what coroners, what clinicians, what families, what the allergy community are saying every year, and what they've been saying for 20 years is that if we just put this one person, this lead in place, it's worked so well in other countries like Finland and Germany, where deaths are, I think, negligible for anaphylaxis. So if this system was in place, we believe our girls would be here, and that I think we're just mums that are trying to help other people to not go through what we went through. But equally, I think we've got a duty. I think most people know either a friend or an extended family member that has some sort of allergy, and it is on the increase.
We know you haven't got a final decision yet, but we have had a government statement through, and the spokesperson has said, we've taken action to address the challenges people with allergies face by introducing a new legal requirement for food retailers and operators to display full ingredients and allergen labelling information on every food item they sell pre-packed for direct sale. And clinical advice and leadership on food allergies is provided by the Clinical Reference Group for Specialised Allergy and Immunology Services, led by NHS England. Now, Emma, I know that at your inquest to the death of Shantae, the coroner highlighted the fact that there is no person with named accountability for allergy services and allergy provisions in NHS England and the Department of Health as a whole, and said that there is a risk that future deaths will occur unless this action is taken. So what do you think a SAR could provide that isn't already available to those with allergies right now?
Well, I think firstly, I think we need a public champion who is an allergy clinician, somebody who fully understands allergies. And it's not just food allergies, the breadth of the types of allergies that people have. And I think just really having sort of a real overview of the whole system. So we describe it a bit like a jigsaw, that we've probably got the outskirts, but there's quite a large bit in the middle, which is that coordination. And I think one person that really understands allergies, that oversees it, has that bird's eye view, they'll quite easily be able to see where the gaps are and what needs filling in.
So what is next for you both?
What's next for us? We're going to see this campaign through. We're not going to stop until we get this Allergy Tsar in place. That's certainly one thing we're doing, isn't it?
Yes.
And then as far as Natasha's foundation is concerned, like I said, there is so much that the more we uncover, the more we speak to people, the more we find out where the issues lie. And these are quite serious issues. These isn't just, they're not gripes. They are often life-threatening situations. We realise where we need to move next.
You're both incredible women. Thank you so much for coming on the show and talking about it. Your daughters will be very proud. And thank you for talking so openly and honestly about it. Lots of people have been in touch with the show and are sending their messages to you. Here, Simon says, yes, we definitely need an Allergy Tsar. Too many young lives wasted totally unnecessarily, and many more thousands hugely limited by fear of taking part in perfectly normal activities like the rest of us. It would be totally unacceptable for someone to say, well, if you have a wheelchair, you just can't expect to be free to enter this building. But you still hear people say, if you have a food allergy, you can't expect to be able to eat out. Also more here, Michael said, clearly more needs to be done to protect people with severe allergies, but we're sidestepping the more pertinent question, why has there been such a significant increase in allergies at the moment? Someone here, I had an anaphylactic episode for the first time last year and must now carry an EpiPen. I don't know what caused it, but suspect food. My GP was very concerned and referred me to an allergy clinic. I've now got to wait 60 weeks to be seen by a clinic. And there's many more, which I'll keep you updated with. But thank you again for coming on the show, and please come back and let us know how it goes as well.
Great,
Thank you for having us.